everybody, Chief Tom Blanchette, the Loudon Fire Department. We just wanted to put out a quick public service announcement for everybody to understand some of the actions that the Loudon Fire Department has taken to keep you, the community, safe and ourselves safe at this time during this unprecedented event that's going on in our country and across the world. First off, we'd like to talk about our daily operations. Currently, our lobby is still open to the general public. If you need a permit, you need to come down to the station to get a permit, or you have a question, come to the front of the station. You'll be able to access our lobby still by coming through this door. Once you're through this door, our lobby is kind of closed off. We ask that nobody comes into the administrative living space of Station 1. All of your work will be able to be done right here at this window. Staff inside may present themselves with gloves on just to reduce the risks to our employees currently, to keep themselves safe. We do issue burning permits still at this location, but we will encourage you to purchase your burning permits online, and we'll go through that process a little bit later in this public service announcement. For both Station 1 and Station 2 is located on Clough Hill Road, we have restricted access to the apparatus bay of the fire stations as well. Only town personnel are allowed inside. They must show the proper photo ID credential that they've all been issued to access the apparatus bay. In poor weather conditions like today, our family members, we're allowing them to come in to swap food, swap laundry for members of the department. We're also in the process of self-screening all of our employees, which we'll cover that process here in a few moments. And we just please stop, don't enter the building, go through our lobby, and we'll try to accommodate your needs that way. We're just trying to keep everybody out of the building as much as possible to keep ourselves healthy and safe at this time. As part of keeping our staff safe and the public safe, because obviously we're having more exposure to individuals that are potentially affected with COVID-19, we've implemented a screening process that is conducive with screening processes put on all across the country. This process has been endorsed by many professional public safety agencies, and that's what we're trying to do as well. So people have a multi-step process when they come into the building. It's outlined clearly. We've asked all of our members and town employees to go into the restroom, wash their hands thoroughly for 20 seconds or more using hot water and soap. Then they come outside and they have to fill out a questionnaire. As part of that questionnaire, they must do a temperature check. Temperature check's got to be done twice a day. So they'll basically do a temporal temperature check. Once they get the temperature reading, there's questions on the board. They'll identify who they are, the date, their temperature, the time. They have a few quick questions to run down through. Do they have a fever? Do they have a cough, a sore throat? Have they had any difficulty breathing, shortness of breath, muscle aches or headache, abdominal discomfort, vomiting, diarrhea, or is there any household family member that's sick, yes or no? And this must be repeated twice in their shift here at the station.
Good afternoon. My name is Craig Clough. I'm a firefighter paramedic with the town of Loudon. Just wanted to give you some additional information regarding calling 911. With COVID-19 going on all over the world, the state is going to be asking some additional questions should you have to call 911 for any type of emergency. Some of the questions would include, does anybody there have a cough? Do they have a fever? Are they experiencing shortness of breath? Are they experiencing any muscle fatigue or generalized weakness? Don't be scared if you have asked these questions. We just want to make sure that we are screening for any potential exposures and reducing the chances of our firefighters and EMTs potentially getting exposed to illnesses. Okay, so really quick, I just wanted to explain and visualize to you guys so that you understand the level of personal protective equipment we're talking about. For any call, our standard personal protective equipment that we would be wearing would include a face mask, goggles, and gloves, demonstrated here by firefighter Zach Powell. When you call 911, we show up on scene. We're going to arrive. We're going to limit the amount of personnel going into the residence or business, and we would prefer if somebody could either meet us outside or the patient themselves could actually meet us outside. So when we arrive on scene, we're going to limit the amount of personnel going in to do the initial assessment. That one firefighter dressed in personal protective equipment, like I had already outlined, will show up to the patient or patient representative and hand the mask to that person, ask them to put a mask on them. Thank you. The mask will be placed over the nose, underneath the chin with the ear straps clearly tucked in, and we would begin our initial assessment. During that course of that assessment, if we find signs and symptoms of possible COVID-19, we would then pause the assessment to add additional personal protective equipment. At this point, we would add in an additional layer of personal protective equipment to include a gown, gloves, a face shield, and an N95 particulate mask. This gives us much increased protection to make sure that we are not exposing our firefighters and EMS personnel to any potential illnesses brought on by the patient. As part of the COVID-19 pandemic, State of New Hampshire Bureau of EMS has released a destination protocol that helps EMS providers try to reduce the amount of patients that are going to the hospital that could be managed either at home or through their primary care offices. Depending on what the symptoms are or the circumstances are, you may not need to be transported by ambulance. For example, just because you came in contact with somebody who may have had COVID-19 does not require you to go to the hospital. Many times these patients will not be tested until they become symptomatic. An isolated cough or a very low-grade fever would also fall into the category of maybe not necessarily needing to go to the hospital for treatment. Many of these minor illnesses and complaints can be managed at home through self-care or through the guidance of your primary care physician. As always, if you're having a life-threatening emergency, please don't hesitate to call 911 so that we can address your needs further.
Also, in an effort to keep our employees safe here at Loudon Fire, we'll be running reduced staffing during fire calls. Example, the engine will show up hopefully with a full crew, but at the same time, if you have something like a carbon monoxide detector, smoke detector, maybe a chimney fire in your residence that we're coming to check, we're going to hold back some of those members, probably only send a couple in to check out the situation initially. And what we'd really appreciate from you is have somebody meet us outside. Let us know if anybody in the house has flu-like symptoms, a cough, a fever, or if somebody there has been diagnosed with COVID-19. That way we can reduce the exposure to our employees as well. If we do have one of our employees getting exposure, unfortunately for them, they're going to have to go to quarantine for a while until proven otherwise. That takes them out of service, takes them away from their families as well. We don't want that situation to exist, if at all possible. Thank you. In regards to permits to kindle a fire, it's very important. We understand a lot of people are staying at home now, they're cleaning up in their yards, they're doing a lot of homework. Just want to remind everybody in the community, very important, make sure you have a permit to kindle a fire if you're going to light one. If it's a category 1 fire, you can burn that anytime during the day. That's a 2-foot round, 2-foot high fire with a permit. Key things with the permit. Any of the others, you need to have a permit. You can kindle fires from 5 p.m. at night until 9 a.m. in the morning unless it's raining. You can obtain a fire permit by coming to Station 1 during normal business hours. If we're not on a call, we'll gladly try to take care of getting you one. If not, we're not here, you don't want to come down unnecessarily and expose yourself, you are following the rules and you are going to stay home, you can go on loudonnewhampshire.org, go to the fire department page. On the upper left-hand corner, you'll see a link where you can purchase an online permit. The cost is $3. That doesn't go to the town, it doesn't go to the state, it goes to the vendor that handles the software package for the state. You can purchase your permit online there. Once again, very important, get the permit, make sure we're burning the right things. It's all explained on the permit, what you can and cannot burn. Once again, thank you very much for your cooperation on this. Hello again, everybody. We're now inside the town's Emergency Operations Center. We're about to close this public service announcement out. I want to thank Craig Clow for helping me conduct this little PSA, and my team, Zachary Powell, firefighter EMT with the camera, firefighter AMT Ben Carter with some of the demos. It's really a team effort, and it takes everybody to accomplish what we're doing here in town. I just want everybody to know we're monitoring the situation all the time. We've got multiple monitors up, multiple computers working. We're on constant communication, multiple conference calls with the state EOC, trying to get the most up-to-date information. We have nothing but the public's best interest at heart here. The most important message we can deliver as we move through this situation, stay home. Simply stay home if you can. Practice good social distancing. If you need something, feel free to call the station, 603-798-5612. Go online, newhampshire.gov, COVID-19. All kinds of information on there you can utilize. And as a fire department, we're going to keep trying to do some innovative things to keep the community engaged and possibly entertained at times, like reading children's books last night. Had a good time with that, a lot of positive feedback, and we've got some other ideas to do moving forward. So once again, thank you for your time. Hopefully you find this informative. If you have any feedback, once again, feel free to contact us, 603-798-5612, or you can simply send me an email, chief@loudonfire.com. Thank you and be safe.
Wash your hands, stay home. Thanks for the support.